Hi friends, we are extremely happy to be part of this newborn nursing training program. We from Neonatology Division, Department of Pediatrics, Government Medical College Kozhikode is dealing with the topic neonatal seizures for next 3 days. As you all know, seizures in a neonate is a very important problem. Seizures are actually most common in neonatal period compared to any other age group. And when we in pediatrics talk about seizures, the first thing which come to our mind is febrile seizures. Unlike other age groups, the causes of seizures are really different in newborn, and conditions like febrile seizures do not exist at this age group. And another thing, the seizures in other children, other age group, are more clearly evident. Clinical manifestations are very unique, whereas in neonates, the manifestations sometimes even may not be there. And a large majority of seizures do not have any external manifestation. At the same time, when you take an EEG, there will be seizure activity. And another thing is, if the conditions like metabolic problems like hypoglycemia, hypocalcemia, which cause generalized seizures in other age group, whereas in newborns, these things can cause focal seizures because of immaturity of the nervous system and insufficient wiring between the different parts of the brain. So the seizures will not spread to all areas. And the chance of long-term sequelae like mental retardation, seizure disorder, all these things are much more common if a newborn develops a seizure than other age groups. Of course, the sequelae are dependent on the cause of seizure also. And the most rewarding thing is prompt and effective management of seizure and good nursing care makes a lot of difference in the outcome and quality of life of these tiny ones who have the whole life in front of them. And much more important is that a large majority of seizures can be prevented. So a good NICU or a good healthcare delivery system should try to prevent seizures rather than letting it happen and then treat. So in the coming 3 days, we are going to discuss different aspects of neonatal seizures, and the learning objectives of this module are: one thing, to know what are the important causes of seizures in a newborn. And both it can vary in term and preterm babies. And the most important thing, how to recognize seizures. The nurses may be the first one to see a newborn seizing, and they should be knowing how to recognize it, whether it is a seizure or a non-seizure event. So that is the most important part of this module. And there are some seizure mimics. We may think that it is seizures, but actually it may not be. So what are such things and how to differentiate seizure from non-seizure or seizure mimics? Then how to manage seizures. There are general management and specific management. And we administer so many medicines in a baby who is having seizures. So what are the things you should keep in mind while administer these medications? What are the problems which can arise during administration of these drugs? How to administer them safely? And most important, how to monitor a baby with seizures. Only if the monitoring is appropriate and you can identify problems in correct time and you can intervene. So how to monitor a baby on seizure, having seizure, and we should know what are the long-term sequelae. Only if you know such problems, or when you are having your follow-up clinic, you are seeing the outcome of babies whom we managed in an ICU. So that will prompt us to take more effort to manage them in a better way so that the sequelae can be avoided to the maximum. And as I have already said, prevention is always better than cure. So how to prevent seizures? So these are the important headings on which this module goes. And uh, the first aspect will be the important causes of seizures, and Dr. Fiji is dealing with that. Thank you.